Okay, go.
5, 4, 3, 2, 1. Hi there, this is our group project for our international health class. And for our project area, we chose the country of Sierra Leone, and our program is called the Safe Birth Program. And this is presented by Michaela Lee, Courtney Messer, Julia Lowell, and myself, Deborah Bowden. In Sierra Leone, they are known for having one of the highest maternal death rates in the world. And in 2015, 1,360 mothers died out of 100,000 during childbirth. That's what makes Sierra Leone the highest mortality rate in the nation. And that's according to this interagency group that was formed that was examining this, and that includes the World Health Organization and UNICEF and a couple of other ones. The most common cause of death is due to hemorrhage, and that makes a problem because of the lack of a ready blood supply for transfusions. The other one is the second most common cause of death is obstructive labor requiring a surgical intervention or a C-section delivery. And the other contributing factors include village home births, lack of prenatal and postnatal medical care, lack of sanitation, adolescent pregnancies, untrained birth attendants, malaria, and nutrition. Okay.
So, an overview of our implementation project is that we will be creating and distributing sterile delivery health kits. These CLIN delivery kits will be made through donations from different organizations, and they will be given to trained birth attendants that will be there at the home deliveries. They will include methods to control the bleeding, prenatal vitamins, instructions, and these instructions may include pictures, whatever's necessary. Clamps, cord ties, sterile razors, gauze bandages, and soaps and other disinfectants. So as part of the intervention, local birth attendants will be certified annually. They will be trained to handle at-home deliveries and learn how to identify high-risk deliveries so that they can prepare the couple ahead of time if they need to make the long journey trip to the hospital. Okay.
Okay, so why our intervention will solve the problem. First part of our intervention was the clean delivery kits. According to the World Health Organization, 15% of maternal deaths are due to infection. And so with these clean delivery kits, it'll help create a place of sanitation so that the mother and the baby don't get infected at their home delivery. And that'll include like the clean sheets and the soaps and other sterile items so that they can have a germ-free place to deliver their baby. And one of the biggest reasons for maternal death is hemorrhage. And so these kits will include instructions and items and information to help control bleeding and what the mother should do in that sort of situation where they are bleeding quite frequently. Many women are not allowed to go to the hospital as part of their traditions. Sometimes their husbands just don't allow it, or they can't make it to the hospital for delivery. So these kits will assist them in birth and also help make the delivery as smooth as possible. And another reason is just many women just like to deliver at home or in their specific villages. And so these kits will make it possible for them to do that free of infection and with the materials they need. The training of birth attendants is the second part of our intervention. Just a little background, Sierra Leone has implemented a free healthcare system for pregnant women as well as children under 5. But because of this, there's kind of a lack of birth attendants because they don't feel necessarily needed, or they don't feel an urge to be trained because they're not getting paid. So those birth attendants that there are not really trained to take care of high risk pregnancies or different problems with pregnancies. And so with our intervention, we will offer compensation to birth attendants as well as compensation for each delivery or prenatal visit, things like that. So there's two things that this will help solve. One, it'll help create jobs for many women in Sierra Leone, help the economy, as well as the biggest thing is these trainings will be help birth attendants who are trained to be trained and available for women who do not deliver in the hospital. And that's very common, and many of the maternal deaths are due to women that don't deliver in hospital. So this will just kind of be an at-home, not necessarily physician, but somebody that's there to help them catch problems, recognize high-risk pregnancies before they're serious, as well as take care of common problems that occur with home delivery.
Okay, so to implement this intervention in Sierra Leone, we would first have to divide Sierra Leone into 4 different regions to allow the local birthing attendants better access to the training. Training of the local birthing attendants is important because it can reduce the amount of deaths during births. The birthing attendants would be trained to prepare for complications during birth that they could help with. They would also be trained to use proper sterilization techniques, and this could reduce the amount of infections that end up killing the mothers after giving birth. The last thing that the birthing attendants would be trained is in early pregnancy appointments to be able to foresee any possible complications during birth, such as pelvis being too small to pass the baby. By having the early pregnancy appointments, the mothers would be aware of the risks that could happen when giving birth and possibly prevent the complications from happening by using different birthing approaches. The training of the birthing attendants would be a 2-day training in the central location in the region they are split up into. The 2-day training would occur once in the beginning, and then they would attend a 1-day recertification every year to allow them to keep up their certification. In order for the birthing attendants to be compensated for their time and talents, the government would need to enforce room in their healthcare system to pay the birthing attendants for each birth they do and the training that they attend. Our intervention would include a letter to the Sierra Leone's government explaining why this would be beneficial to them and ideas of how they can make it happen. If the birthing attendants were being paid for their labors, they would care more about the work they do. With the sterile birthing kits that we would provide to be accessible to pregnant mothers, and early pregnancy examinations, and the training of the midwives of the birthing attendants, the death rates of mothers after giving birth would decrease. And this is our intervention.